Dr. Vivekanandan is a psychiatrist who studied at CMC Vellore and JIPMER Pondicherry. He is a gold medalist from Tamilnadu, Dr. MGR Medical University. He specializes in marital, psychosexual counseling, child mental health, and personality disorders. So at present, Dr. Vivekanandan is the district psychiatrist, district mental health program, Salem. Doctor, you take over.
Vanakkam. So thanks a lot for the nice introduction, ma'am. Actually, like 2 weeks, 1 week before, ma'am actually called me and she told that like we have a program like this and we have a topic. Actually, we now it is very common like COVID awareness and stress management. That is the usual programs that we conduct. Every 2 days I go and conduct programs. But this time when she gave me a topic like gadget addiction, I was feeling something was different, and I felt that this is a need of the hour and we should discuss it. And now like ma'am told that there is a good response and there are parents who are coming in. I just have a question. Why are we here? Okay, as a psychiatrist, I should be sitting in a clinic and seeing patients. As parents, you should be taking care of your work and like you have your own work. Why are we here sitting and talking about something called as gadget addiction or something? To be frank, nobody is having gadget addiction. But thing is that we are having abuse of gadgets. We are using gadgets inappropriately to increase time or increased amount. We tend to give gadgets to children, okay, unknowingly or knowingly. The thing is that why it is important to be dealt here is we call this as a health promotion program. Okay, what is this health promotion program? Is that when you have some lifestyle changes like having spicy foods or having like too much of like alcohol, cigarettes now, after 20 years, you will have myocardial infarction. Rather than treating it there after 20 years, you try to treat what can be done now. Okay, that is called as health promotion. Changing something now so that the future will be better. Similarly, I hope that nobody will be having gadget addiction, whoever is in the meeting. But one thing is that we abuse gadgets. We use gadgets to an increased amount of time or increased amount of leaving other works. We tend to be more clinging to the gadgets. That we call it as gadget abuse. Now, if we work on the gadget abuse, in future, there will be a lot of problems which can be prevented. Okay, that is called as health promotion. That is why we are here. Throughout this journey for the next 30 minutes or 40 minutes, I would like you to take you along with me, my experiences for the past 7 to 8 years that I had with people who are abusing gadgets and who had fallen for gadget addiction. Many a times parents comes and tells me that, sir, why is my child always looking into the phone for 1 month of food, for making him sit and like without any gadgets, it takes me nearly 20 minutes or 30 minutes to make him feed. But if I give him a phone, like the food gets finished soon. Night, like only if I give the gadgets, the child sleeps. So what is happening? Why is he not talking with me? Why is he not playing with me? Why is he not playing with other kids? Why is he keep on clinging on with the phone? What is this, sir? Is this gadget addiction? Should I be concerned? Should I be worried? Should I change it? If I change it, he becomes very irritable. He fights with me. He demands that he needs it. So those things, when parents comes with all these questions, I used to give them one single answer, and the answer is dopamine. Okay, dopamine is nothing but a chemical in the brain. Okay, that creates a lot of changes within oneself that results in a lot of these things. Okay, dopamine is a neurotransmitter basically that controls pleasure in the brain. Okay, now how does this happen is that it will give you what is called as pleasure. What we call in medical terms euphoria. It gives you a nice feeling. Okay. Now what happens is that rather than just giving an euphoria, it gives you a feeling that this is more than anything else. This can be explained by one mechanism called as emotional hijacking of dopamine. What happens is that if a child, sits and prepares for an exam, gets some good marks, the parents gives him a pat and like the teacher appreciates in a class. At that time, what happens is that they will have one dopamine that is released. Now, if they go and play with other children for 30 minutes, 40 minutes, they have a nice play time. Okay, they have a good time. At that time, what happens is that they have two dopamine that is released. But if they just open up a YouTube channel, they just start seeing things. What happens is that it is too colorful, it is too bright, it is too like different themes are there, a lot of YouTube channels are there. Now what happens is that the brain releases 10 to 15 dopamines. When one dopamine is for studies, when two dopamine is for play activities, when 10 to 15 dopamine is released at the same time when you see a gadget, naturally what happens is that your brain will get tuned to that one particular thing. It's like when I'm working in a company where they give me 1 lakh of salary. For 1 year, I am working for 1 lakh salary per month. And suddenly they ask me for another job where they give me like, occasionally we might give you 2,000 or 3,000 or 10,000. And the madri, when they give me a salary, I will not opt for it because I know that 1 lakh salary is something big. It gives me a lot of things. It is able to match my needs. So naturally my brain will be opting for only that. That is the reason why students who are more into gadgets, spend less time on mingling with other friends or spending time with books or like showing other talents or working on other talents. That's the reason why that mechanism was called as emotional hijacking mechanism. It's all because of the dopamine trap. Now what happens is that once you are accustomed to it after some years with like we are the children of this with the gadgets. Now what happens is that once the gadget is removed from them, you say that no, only 1 hour or 2 hours, you remove the gadget. What happens is that this euphoria will become hypophoria. What does this hypophoria means? Euphoria means pleasure. Hypophoria means less pleasure. Naturally, the pleasure which was there with the gadget or YouTube, now there is no, the pleasure has decreased. Now they'll be a bit dull. They'll be like, they will ask again and again, but you will not give. But slowly this hypophoria will not stop there. Now the dopamine is going to be villain. It will result in what is called as dysphoria. Dysphoria means they will become irritable, they'll be demanding, they'll be arrogant. Actually, and what we think is that we are intelligent. Child is like we are actually training the child. We will be thinking, but actually children are brilliant than us. You know what is called as Flynn effect, right? Flynn effect is that as generation goes, the intelligence increases. My father's intelligence, my intelligence, and my son's intelligence. If I compare, my intelligence is actually more than my father's intelligence. It's because of the exposure and the connectivity and the network that I have. To be frank, my son's intelligence is more than mine. I should accept the fact. Okay. To be frank, children know. They know how to do all the drama and get the gadgets from you. They know how to show tantrums and how to create a drama so that they get the gadgets from you. It's called as Flynn effect. They are more intelligent. And actually, this is called as dysphoria induced by dopamine. Initially, when you give, it is euphoria. You remove it, they are less pleasurable, it is hypophoria. And naturally, as days comes by and the brain dopamine is getting tuned in, there is a lot of changes. It results in dysphoria where they feel that I need it. Otherwise, I'll show tantrums. I'll become arrogant. I'll shout. You need to give the gadgets. That's how things are. Now you should ask me a question, sir. If when they ask me for gadgets, sure, I am telling them like what to say. There are various disadvantages you should not use, but they don't believe me. Is it true? Am I genuinely saying my kid that it is causing harm to them? There is a research that gadget use affects three important things: psychosocial, biological disadvantages, psychological disadvantages, and social disadvantages to young brains. What is the biological disadvantage that it causes? See, what happens is that they usually say that when you keep on sit and watch gadgets, you have less time to go and play. So naturally, what they call as couch potatoes. Naturally, it's not that like we are body shaming them, but naturally they don't have activeness to go and play. They become less energetic. I've seen a lot of parents come and say that, sir, like they for like when they go for a temple or long walking, which is not their normal thing, they said, I'm having a lot of body pain, I can't walk, because it's not usual for them. So naturally they become lazy, they become less active, they become a lot of tiredness get into their body system. Second thing, what happens is that this is actually ophthalmologist area. Okay, what happens is that when you have too much of gadgets, okay, a lot of things, whatever that we give the phone or iPad or whatever it is when they sleep. So what do they use? They have the gadget very close to them. And in the night, you want to sleep because you are working from morning to night and you want to have some sleep. So naturally, you switch off the light and you give the gadget so that the child sees. You say that volume, you should see the way with the no volume. And they are happy. They have it. Now what happens is that they have it very close, and this blue radiations affects your eyes. And what is the problem is that it results in short sightedness, myopic vision. Okay, so what happens is that they get a myopia where they need to have glasses in a very young age. Another thing is that dopamine, as is an association with dyslexia. I hope you have an idea about ADHD also, attention deficit hyperactivity. Attention deficit hyperactivity is also something related to dopamine. So what happens is that when you give too much of dopamine with these gadgets, what happens is that they will not be able to sustain their attention. Okay, you will be putting them in OT, you will be taking them class, and you will like help them to improve their attention. But at the end, you will give them gadgets. Now, what are the improvements that you have done in the attention side is lost. Okay, and they become more hyperactive. The dopamine makes the attention less and the activity more. That results in a lot of hyperactivity and inattention. Another one thing that a lot of people come and ask me, sir, does that result in, does this gadget use or phone use or TV use results in speech delay? Does the delay in speech? Okay, the answer is yes. Okay, if you have noted how all these children, all small normal children, or like all children, how they get speech or the skill of speaking is that imitating the child. The mother says that like what is a like what is a uh, this is sun, this is moon, or this is called as a bucket. The mother keeps on telling the child slowly picks up words. Now suddenly the child says that this is bucket. Now the mother gives a like what to say and reinforcement and appreciation. Wow. So now the child, okay, I will repeat it. So that's how the child keeps on building the words. Now with the gadgets, there's nothing called as reciprocation. It's a one-way communication. I just see, I just observe, and I just leave it. There's nothing called as a reciprocation, and there's a lot of speech delays and echolalia. Echolalia means they just copy one, two, or three words from the rhymes, and they keep on repeating it rather than just putting sentences or forming words. There is a lot of speech delay that has been observed. So basically, biologically, they become less active. There is a lot of obesity, and there is actually a problem to the eye. There is a problem to attention and hyperactivity, and very, very importantly, speech delay is also being noted. These are the biological disadvantages of gadget use. Psychological disadvantages is what I am. It's my cup of tea, because I'm a psychiatrist and I deal with it day in and day out. Psychologically, what are the problems with gadget use? See, what happens is that uh, Facebook, Instagram. Okay, when I was a school student, I hope I was not exposed to that, or maybe it would have not started at that time. But as I started to college, Facebook was something great. Okay, now Instagram followers, all that is there. Now people are like, what happens is that how many followers I have, how many friends I have. Like if I post a picture, how many likes do I get? How many comments do I get? Now when another friend is getting too many likes or too many followers, I feel that I'm missing out something. Okay, we have something called as FOMO syndrome, fear of missing out syndrome. Now what happens is that I'm really worried that, okay, I don't have any skills. That person is chuma there, he's doing some keyboard thing and he's getting too many likes. He's just moving some steps and he's getting too many likes. I'm not doing anything, I don't have any quality. It questions their own identity. It questions their own self-image. What is the potential that I have? What is the likes of myself? Should I be happy about myself? Should I be proud about myself? Another thing that is there is that, what is the difference between playing in a group where there are 3 to 4 friends or 5 to 6 friends? Psychologically, how does it help? And watching 1 hour of YouTube, how does it help? See, when you play with friends, you should have seen your children playing, right? They will fight. Okay, but then they will say, "No, I will not talk with you, and then another 20 minutes they will fight. They'll be like gel friends. So it's how they play, and they will be just. It's like how they become socially well. Also, they know that, okay, this is not my turn. It's the turn of my friend. I should wait for my turn. I should appreciate him so that I will not fight with him. It's like they learn a lot of things psychologically. They learn a lot of things. But what happens is that when you are with a gadget, you don't like this channel, you change it. You just go to the next video. it is taking some streaming problem, go to the next video. If there is a network problem, shout from here to your mother, ma, what is the problem with the net? Mother will come, okay, the child is doing something great with the gadget, I'll check what is the net problem. And now what happens is that they have a problem now with the younger generation, is that they have some mechanical problem, is immediate gratification problem. Immediate gratification is, I want it now at any cost. Okay, there's nothing called as waiting. Okay, previously when I ask for my father for a dress, he will say that Diwali ki paathukalam. Diwali will be with like 6 months later, and I have to wait. Okay, when I ask my father for a bag, he will say only with the next year, yeah, he will give me. But now things are readily available for them. The net is readily available. That makes them that I want it now, and if you are not giving me, I'll show my tantrum, and I know how to get it from you. That results in immediate gratification. That is what like what happens is that these are all starts at a very young age, around 10 years or 12 years, but around 18 years where the personality develops, I see a lot of personality problems where they have anger management issues, gratification issues. They are not able to sustain their attention for long perseverance, work for large goals. There's a lot of problem with young adolescents that I see. Now, socially, what is the problem is that they are not mingling with others. So naturally, they are like, what happens is ஒரு ad வரும், teacher சொல்லி தரலையா sharing அப்படின்வாங்க. They do not know what is sharing at all nowadays kids. Okay, until if there is some 2 to 3 siblings in the house, they know something we should share. But what happens is that when you are not sharing, what happens is that personality, when they develop one personality character that we call it as agreeableness. Okay, I agree with the other person so that I can just see what is point in them, or what is the positive in them, or what I can agree from them. Agreeableness is a very good quality, so that we are all social animals, right? We like to be mingling with a group, but that is lost. And naturally what happens is that you're all socially isolated, and when they have a problem, they don't have a person to go and talk with. They say that, no, I will not talk with my mother will judge me, my father is always angry, my father is always busy, I will not talk with my Facebook friends because they will make fun of me. Then where is the friendship? Whom I will go and talk with? Where will I share things? That is lost. Now, what to be done? Okay, sir, you are saying that biologically there is problems, psychologically there is problems, socially there is problems with the gadgets. What should be done? How should we manage? Okay, I'm not going to give you some superb, like what is a new guidelines or something. I'm going to say things which you have been following or which you have heard. If you, at the end of the like next 5 minutes or 10 minutes, if you're going to say me, see Dr. Vivekanandan, I have been already following this, this is not something new. If you're going to say this, I'm going to give you applause and say that please follow this, and please give advice for others also to follow. If you say that, no sir, I know this but I'm not following, please put it in action. Okay, it is always said, in Tirukural, whatever you know is of no use unless you put it in action. So please put it in action. Okay, the first and foremost that you should know is what is called as screen time. Okay, screen time is very, very important. Though we all follow Western culture guidelines, but this is something which you should follow. Less than 1.5 years, you should not expose the kids to phone at all. Less than 1.5 years, no phone, no gadgets, no laptop, nothing. Even if they jump up and down, no, nothing doing. 1.5 to 2 years, what they say is you can expose them to video calls to distant family relatives. 2.5 years, it will be like less than 10 minutes or 15 minutes or 20 minutes. 2 to 5 years, the screen time is 1 hour. Imagine screen time is 1 hour. Okay, and after 5 to 8 years, based on like the educational inputs that they get from the device, you can fine tune it about 2 to 5 years, 2 to 2.5 hours or something. Okay, but make sure that till 2.5 years, there is nothing called as gadget for rhymes or nothing. If you know some rhymes, you teach them. Otherwise, YouTube need not teach them. Okay, they make it very clear. Next, we have something called as gadget. This is called as screen time or gadget time. Okay, you should be very clear in them. I'm not giving you more than half an hour or 1 hour. Next is called as gadget place. What is this gadget place? Gadget place is that you will be allowed to see a phone or a laptop or an iPad only in the hall. Okay, you're not allowed to take it to a separate room. Okay, why is this? It's because of two things. One thing is that if you give them half an hour and they say that they are like, if you are there in the hall, they will be have a real visibility so that you can prompt them. See, it's already half an hour, only extra 5 minutes, stop it. So naturally the screen time or the gadget time is controlled by using gadget plays. Another thing is that you will be watchful what the kids are watching. Okay, there is a lot of videos that expose them to contents which is not needed based on their age. Okay, pornography, okay, gaming, video gaming, okay, gambling. There are things which are really addictive, which is which comes as pop-ups, which if they are seeing in an, what is a room where you don't have visibility, things might go wrong. So that is called as gadget place. One is gadget time, that is called as a screen time. Another is a gadget place where they are exposed only in the hall, where there is another person and another elder in the family. Third is a gadget availability. Gadget availability is what is said is like, it's like usually I follow it with alcohol people. Okay, what happens is that they say that, sir, I took alcohol because I had alcohol in the house, sir. That's why I took alcohol. Otherwise, I would have not taken alcohol. Similarly, what happens is that when you have too many gadgets in the house, with that, like usually now, like every house has 3 to 4 phones. They have one pad, one laptop. Now, what happens is that when there is too many gadgets, you do not know where the child is watching or what the child is watching, which the child is using. So basically, for you to watch things, you should use only one gadget. If it is not working, it is not given. That's it. It's not that, okay, I have some work here, so you go and use this gadget. What happens is that when you tend to relax things, they tend to take advantage of those things. Okay. If you are giving a phone, just make sure that you give the phone. If the mother is on another work, you tell that you have to wait for 1 hour, you just play some other activity, then only you will be given the gadget. When you have too many gadgets, it means that you are unknowingly making them risk for gadget abuse or addiction. Okay. Fourth important thing is that that is something for you, setting a good example. Okay, you can't just scroll on looking into all WhatsApp messages. You can't look into Facebook and posts, and you can't tell the child don't look into the WhatsApp or don't look into the phone. Now kids are smart. Ma, what are you doing? Avladhan. Total zip தான். You can't say anything after that. So basically, you have to set a good example. Though it is something office message, though it is something office, like what is a page, you have to do something. Make sure that you do not do it in front of the kids, because tomorrow the kid demands it. You also watch, I will also watch. What is wrong in it? When you do something wrong, do it is right. When I do something, why you say it is wrong? You can't. You need not bring those type of arguments into the picture. Another thing is that, see, it's like. Only when you are empty stomach, you try to crave sweets. Okay, when there's sweets, no, when the table is full of sweets, I'll try to take like chuma. If the session is going on, I'll keep on taking munching sweets. If I am half full with food, naturally I will not take too much of sweets. Okay. Similarly, when the day is not structured at all, okay, when the day is not stimulated, naturally they use this as a stimulation. You give them stimulation. There is a lot of things that is happening. There is something called as drawing, there is dancing, there is singing, there is a lot of skills activities which are built online, or it can be done as if the COVID pandemic is going, you can go it make them enrich in a class. Why should we do all this? Actually, is it like make them like zoom out from the gadgets, or it is to do something? It is to develop two important skills. One we call it as pleasure, another is called as mastery. What is this pleasure and mastery? Pleasure is something which I do, which gives me happiness. Okay. It's like pleasure is something like, for me, pleasure is like Ilayaraja music. Okay. Whatever happens, when I listen to Ilayaraja music or A.R. Rahman music, some good feeling happens to me. That is called as pleasure. Okay. Mastery is something, is a talent which I have, and I try to work on it so that I materialize, I fine tune it, so that I tend to be more, what to say, perfect in it. That is called as mastery or talent. So naturally, what you should do is you should involve your children. Actually, you should flood them with opportunities. Okay, what they say usually, my child psychologist used to say that children have an elephant's appetite, it seems. Okay, what happens is that you can't say that, okay, you go for singing class once in a week. No, it's for you. Okay, we have less brain, children have too much brain. Okay, naturally you flood them with a lot of opportunities. Okay, they will, you just observe how they are doing. There will be some inherent talent with them which you can observe that they are doing extraordinarily well in something. Okay, you should just make them concentrate more on it. Similarly, they might be like singing something. Okay, if they are really tensed or angry or like what to say, rather than just showing a tantrum, they might hear a song and they may cool down. That is what is called as soothing them down, or pleasurable activities. Try to find out what are all the pleasurable activities, what are all the talent activities. For that, what you should do is you should involve your time with children. Okay, you can't just tell that, okay, I've given 40,000 to the school, let the school take care of the responsibility, let them take care of it. We can't just say that that is the responsibility of my school, that's why I'm giving them the fees, why should I do that, why is my headache. You can't say that. Okay, you need to take active participation and find out what is there with the children. Now what happens is that when you are there with the child, when you involve with the child will open up. Okay, lot of parents comes and says that children are not opening up, children are hesitating to communicate with me, children are hesitating to talk with me. That more happens with fathers. Okay, at least nowadays fathers are better. Now actually my father used to be like give me a lot of rules book once I became an adolescent, and there was a lot of cold war between me and my father. Okay, now actually it is like, as a psychiatrist I'm trying to work on it. But what happens is that lot of things, what happens is that as the child become an adolescent, there will be always like, I want to take control of things. So in there, only when you involve with the child, when you are with the child will try to open up. Basically you need to be more like a friend rather than a parent. You need to give the, if you are a friend, as a friend you should not be too much, like what to say, permissive. Okay, whatever you do I'll be there. No, not like that. I will say what is right, I will say what is wrong, I am there to appreciate you. It's like what we call it as, you have all gone to a garden, right? There'll be a lot of flowers. The flowers look nice only when there is a background of greenery. Okay, imagine the flowers without the background green, it won't look nice. Okay, naturally the punishments or the rules will look nice at the background of lot of affection and reinforcement. Give them a lot of reinforcement, give them a lot of appreciation, involve the child, play with the child. Okay, I see a lot of parents busy in the work. One advice I give them is, you are replaceable in the work. If Vivekanandan is not coming to today's class in this webinar, there will be another skillful psychiatrist waiting to take this class or take this webinar. He will do it more interestingly. But if I'm not playing with the child, there is nobody to play with the child. You can be replaced in the work friend, but you can't be replaced with the kid. So you need to take responsibility. You can't say that Amma will take her. No. Father, if the fathers are listening this, make sure that it's your responsibility too. You can't just dump everything to Amma. Amma will take her. Amma will take her. No. I will. It's my kid. Taking care of my kid is my responsibility. Playing with my kid is my responsibility. Finding out the talent of my kid is my responsibility. To make my kid watch less on gadgets, I need to set an example. So I will not use gadgets in front of my kids. That is also my responsibility. That's how you, as a parent, create an environment where the kid grows and nurtures, and we are just making the environment more friendly for them so that they get a lot of things in the world. So with this, I just stop so that I can get your feedbacks and like questions.
It was
Thank you.
very